And as people are joining, I'll just let people know it's slightly different this week. We actually have an agenda. So it's ODI Leeds, so it's not a very detailed agenda. And we are going to try and keep these sessions quite short. I'll just put the link to the agenda in the chat, so people can have a look at that. And we've still got people joining us in the waiting room, so I'm just getting them in now. But if you get a chance to have a look at the agenda, which is in the chat now, you'll see that we've got a couple of contributions from friends and partners of ODI Leeds and of Open Data Saves Lives, so we're going to get them to share. And we've got some people who want to join us next week who want to join in and collaborate, which is great. So we'll go through that in a second. We've still got people joining the waiting room, so just bear with us. Okay. So, my name is Paul Connell from ODI Leeds. You'll see the ODI Leeds teams. We've all got our Open Data Saves Live backgrounds. If you want that, we can send that to you. You can use that. It's free for everyone to use. And also, most of us have got ODI Leeds t-shirts on, which you'll see here. We'll talk about t-shirts in a bit. If you'd like to buy an ODI Leeds pink t-shirt to help us with the Open Data Saves Lives work, that's we're going to be doing that, and we're also going to do a white Open Data Saves Lives t-shirt for anyone to buy as well. So we'll be sending through some links about that. Obviously, swag is important at this part of the to keep up momentum. But if you have a look at the agenda, what we're going to do is the same thing as usual. Try and keep this quite pacey. I'm going to try and keep it under 45 minutes so that we get some useful work and focused on the mission of what we're all trying to do. We've got a number of guests with us this week. So if you see, we've got Mark and Paul and some of the other team from Beautiful Info who are going to talk about some of the work they've done. NHS Digital are hopefully going to share with us some early versions of their open data platform and what they're looking to do with it. I think Sarah from NHS Kent and Medway is going to join us next week, which is great. I'm going to just go through some of the work we've been doing and some of the team have been doing on the visualizations and the data and some of the thoughts about what we do next. And then Jenny Tennyson from ODI HQ is here as well, who have just launched a whole load of support around open data and the COVID-19 crisis. So Jenny's going to give us 5 minutes intro on that and also contribute as always to what we're doing. And if people could think about additional use cases that people can work on, that would be great. Think about what do we do next? What do we do with this Open Data Saves Lives ecosystem, the work we're doing here? And also, if there's anyone else would like to formally or informally partner with us, that would be grand. And I've already mentioned t-shirts, so we'll get that. So as people are still joining us, so what I'll do is I'll just share my screen with you so that you can see the agenda. We'll give it another minute or so, and my brief introduction will be finished. So, okay. So if you've not been with us before, welcome. If you have been with us before, you know the deal. This is week 5 of Open Data Saves Lives. So it's our response to the COVID-19 pandemic. it also builds on the work we've been doing at ODI Leeds over the past 6 years, but also more specifically since we launched Open Data Saves Lives last year. And this is almost like I wish we'd done it 3 years ago, but hey, that's just the way things go. So there's a whole load of work that people are looking to share, looking to collaborate, looking to build, create the right data infrastructure for us to respond appropriately and with pace. And I think that's really important for us, is this has to be with pace. The time for writing a data strategy, a policy document, a white paper is over. It's about action, about how we can create, build on the existing and amplify the existing tools that already exist, and work together to do that. So it's a mission-led approach. It's an action-led approach, if you like, and you're all welcome. So rather than listen to me go on too much, if you want to find out everything that's going on it's on the hub page, Open Data Saves Lives, which is here. So that's the dashboard. And the Open Data Saves Lives is, if you Zoom is playing up. If you go to the ODI Leeds website, dead easy. Go to the Open Data Saves Lives hub page. Some notes about why it's important. Records of all of the online sessions. The resources around the data page, the Slack workspace if you use Slack, a whole load of great stuff that people have already done on this, and some feedback about work we've done. So there's quite an interesting approach with the Public Health England data that we were using our visualization, which was working, which wasn't working, which broke and then got fixed. And that's great, because then we've written all that, and it's a great learning, and hopefully we'll get to that place a lot quicker in the future. Okay, so it's all there, it's all on the web, it's all searchable, and we're using the web as it was intended. So if you would like to have a look at that, that's great, and feedback whenever you're ready. We talk about being radically open, and this is it. So it's all there on the web, it's searchable. We're not creating any walled gardens, we're not creating our own little place which only our friends can come into. This is available to anyone to join in and build what is necessary now. So what I'd like to do is, in that vein, is ask one of the beautiful information team to just talk through a couple of things they've been working on over the last couple of weeks. And is it Mark or is it Paul, or which of the team would like to join in with that?
I'm happy to. Paul, if you're on, remind me to mention the open day date as well. So we're doing a kind of virtual open day, I think next week, which people...
Yes, a week today.
Week today. Okay, so if we post that on our site, and we'll link it to you, Paul, that would be really cool.
Yeah, absolutely. That's what it's there for.
And between the Pauls, we'll tweet the hell out of it.
And we'll be covering COVID-19 projects as well.
Yeah. Thanks. So, Paul, I'm just going to share my screen.
Yeah.
Show you a couple of bits and bobs. Okay, got my screen?
Yeah.
Okay, so this is really just to prompt me on a couple of things. These are all referenced, as Paul said, there's a thing called the internet which does all this. So we've got a link on our site which links across to the ODI Leeds site as well. Couple of things to mention, then I'll show you some data and maybe talk through some data. The first one is that, given everything that's gone on, what the NHS usually does with well-meaning intent is it kind of, everyone goes inwards into their organisation and starts creating a load of work that's going on in every other organisation as well. And it's quite poorly joined up. And what you get layered on top of that is an industry where people have to send lots and lots of data off to the centre. And we talked on this call last week about a hashtag of get the data back or something like that, because the amount of data we collect, we're not really sure where it goes. It doesn't seem to be getting reflected well in ministers' questions. You sometimes get a Tableau dashboard, which NHSI or E might do, but fairly high level, doesn't really get you down into any sort of detail. And actually the data that we're creating would be very helpful if we pulled it locally. And in the NHS, they have these sort of regional things called STPs, and our one is Kent and Medway. And geography is a really interesting thing, and there's a level at which it's about right. So Kent and Medway, for example, it's about right. It's different enough to London and Surrey and Sussex, and it's got a big enough population that you could do a good linked data set on. And we've got 4 acute trusts, 2 million people. So it feels about right to learn stuff. And to that end, on our site, we've put on a couple of things here. So we've got a link about the data spec that we think is useful, that actually might automate and drive all of the analysis that's going on. So instead of people, because at the moment we're just coming out of a situation where everyone was counting oxygen and ventilation in different ways, which is crazy. So we've agreed a spec which is on this site, which links across to Paul's, which says here's a row level pseudonymized patient level data set that you can all put together, and if other people around the country want to use it, that would be really good. So that is there as a resource. What we've also put on the site is a link here on at a higher level. There's a PDF on here which explains how we're going to build a linked data set for the region, and we were sort of doing this anyway, but COVID has made it much more interesting. The sort of user case at the moment that I'm talking to people about is intimate partner violence, or IPV, and there's some growing data which you're sort of seeing on some of the Sunday papers about people being in lockdown and domestic abuse kind of spiraling. And the data is quite thin, to be honest. It's kind of numbers of calls going into refuge and people like that, but it's really important. And my personal politics are such that we should link our data together, which is where Open Data Saves Lives started, from a thing called Data Saves Lives, which is you take the premise that you have a social contract with the NHS that allows your data to be used for good things, which I'm comfortable with. So there's a couple of resources on there. I'll just show you a couple of things we're doing also locally. So this is real data, so kind of treat this sensitively. So this is a mobile dashboard we've put out in our trust. We're looking at linking this to other organisations as well, just showing you kind of how many COVID cases. These are three of our main sites: Canterbury, Margate and Ashford. Total number of cases. We've done a lot of work working out how to count oxygen. We've done a lot of work looking at ITU capacity, ventilated ITU capacity, and so on. And if this draws here, what we've also done is bring that up into things like PowerBI. So you start to see some aggregate level data of COVID cases. So what Sarah will speak about next week is that the imperial model would shoot off the top of this screen before coming back. But we've got some pretty good data locally now, which is showing that the curves are starting to flatten here. And we're now into, and this is another really good example of why wouldn't you share all this data? Trusts are just starting to think about how are we going to plan for all of this coming back together? How are we going to get all the elective work re-going? How are we going to get the non-urgent cancer treatment back in? And these are going to be huge modelling exercises, and it's going to be so much better if everyone kind of shares their approach and a data set. So we're going to try and kind of lead a little bit locally, do some regional work, and be a kind of an exemplar on how to model, how to get the theatres humming again, how to get outpatients opened up, because it won't simply be lockdown finishes and then everyone's back to normal. It's going to take a long time to put this back together and think about how we model it. And all those resources don't suddenly become available in the same way that they were before, because we've redeployed all our junior doctors to go and help in different areas. All the leave patterns have gone out the window. So it's going to take some quite significant modelling, and it would be such a shame if that was done 150 times around the country and not shared in any way. We've got a whole load of stuff on here, which I can share kind of examples of. The next big thing for us is working out swabbing, how many people were swabbing, which is here. lot of people starting to worry about oxygen flow. We think we're okay down in Kent for now. This is our oxygen capacity, so we look kind of well within that for different types of oxygen at the moment. But at kind of at different levels, we're doing kind of different analyses. So you'll hear in the sort of press, a lot of the conversation is about ITU capacity and invasive ventilation capacity. But the data we're seeing locally, and it's early and rough, and I'm kind of sharing it here anecdotally between friends, is that quite a small proportion of patients make it to ITU. So we've got a vast proportion of our patients are dying on wards. So these are patients that are kind of have reached a ceiling of care, have got multiple comorbidities, are very elderly, are male. So we're seeing higher death rates in males than females. Encouragingly now, for those that come to hospital, we're seeing higher numbers of people discharged than die. So in that sort of first week or two, those odds were about 50%, but encouragingly, we're now seeing higher numbers of people start to discharge. But the reason I'm quite passionate about sort of joining these calls is because the way the data is getting reported nationally is very clunky. And another thing I think I mentioned, which I'll hope to have some results for you very soon, is a comparison of the number of people who died with COVID and who died because of COVID. We've got some early data on that. The numbers are relatively small because nicely, the numbers of deaths are relatively small. They're smaller than we thought they would be at this point, but that isn't getting reported. There's some kind of early commentary on the BBC about this, which is really good, but a lot of very general commentary about how everything's counted differently in different ways. So I think there's some quite nice intelligence coming out. There's something we were looking at this morning. There's an app which shows some people have agreed to take part in the use of an app which tracks their movement, and it shows that as COVID broke out, you can in theory say Leeds was really compliant, whereas people in Margate, were on the beach because the sun came out. And there's some early data around that, but it's the usual thing of kind of hidden behind an NHS firewall, which I think is quite frustrating. So I'm kind of using this period, which I don't think will be too short. I think this kind of relaxation, if that's the right word, of some of the information governance around this, I think will continue into next calendar year in a positive way, and it will allow us to share data much more openly. I'll stop there, Paul, because you've got quite a packed agenda, but I'm happy to share any of this, links to it, screen grabs, slides, whatever people need.
Great. And then just to finish off, and then there might be some questions as well, is and we'll take them as we go along, and then maybe sweep up at the end as well. The way you've built your dashboards, the code, how are you working with that now? Is the data and the code open, or how is that working? Or how would somebody working for another part of the NHS either talk to you about deploying this, work with you, share their version and improving it? How would that work?
Yeah, just get in touch. It's all standard technology. So if I'm still sharing this type of thing is just a SQL database behind which we could share the spec for, and a .NET website. I put PowerBI up just because a lot of people are using PowerBI. It's not an open source technology, but we'd happily share the code we've used to write it. But it was more putting up there as kind of display, so that if people wanted to pick up an open source dashboarding engine, it was really there just to give advice on colors and layout and that type of thing. So anyone who wants to use any of this, just get in touch and we'll share how we've done it.
Fantastic. So we'll carry on, and there'll be we'll get up a story blog and maybe a technical blog about how this has worked. And I think for us, this is how we amplify good practice elsewhere and get someone in Carlisle who wants to do this, building the same thing as you've got in Kent, and all the other great stuff that could happen, and how we drive innovation rather than a whole load of process and everyone doing the same thing. So yeah, that's fantastic. Thanks very much, Mark.
Cool.
have we got any questions for Mark? If you want to put your hand up or put a question in the chat. Okay, I think you got away with it, Mark.
Nice.
Excellent. Next one is we've got, hopefully we've got Alistair or Jessica from NHS Digital who want to share some of their progress. Hi, is that Jessica? I can hear.
Hi, yes it is, yeah.
Great stuff. Hi, Jessica. So we've been working a little bit with NHS Digital before doing some work in the open, and hopefully you are going to tell us about the early prototype version thoughts that you've got for your new open data platform. Is that right?
Yeah, that's fine. Am I right to share screen?
Do it. I'll stop sharing mine and you can share yours.
Joke. So yeah, just a bit of background. I'm a fairly new graduate at NHS Digital and I'm working with Alistair, who is on the call, but I think has disappeared, so something else must be kicking off.
Okay, cool.
And I've not long joined Alistair's team, and we are working on the open data strategy and through that the open data hub. So I'll be this might seem a bit rushed, but obviously we are pushed for time, but it's just to give you a bit of a flavour. Yeah. Can everyone see that?
Yes, we can.
Okay,
over to you.
Fab, thank you. So we found pre-COVID-19, we found some use cases and some user needs that our open data could be used a lot better and could be showcased a lot better. So from that, we've kind of dabbled into the idea of an open data hub for NHS Digital open data. So specifically centering around that healthcare data, and especially with our current situation right now with COVID-19, it seems it could be more useful than ever. So the three main components of this open data hub is a better way to find your data. Right now, obviously, this is very much a PowerPoint presentation, like there is no technical around this, but we would hopefully have a better way to search our open data and kind of group these into themes, just make everything a bit more visible in one place, easier to find. We also want to kind of create a section that focuses around the products that use our NHS Digital open data. Initially, we are thinking just NHS Digital at the start, but maybe this could open out into external organisations as well. Particularly right now with the COVID data that we're releasing, there would be a lot of our COVID dashboards and things like that. And another area that we are quite excited about would be our community section. We want to really enrich that open data community, and this would be through events. So again, internal NHS Digital events, but also hopefully external events like this be really helpful. We also want to improve the guides that we offer in our documentation. This is, oh, there we go. What's going on there? Yeah, we want to improve our documentation. This is the kind of thing that we want some input from people like you, is we want to know what kind of documentation do you find useful? Is this things about like how to scrape our website? We know a lot of use cases use our data for geographies and things like that. Would it be more information on that kind of thing? And the final aspect of our community part of the data hub would be blogs. Again, we want some input about what that would look like. Is that what projects that we're working on? We've heard that people struggle with all of our many acronyms. Is it a blog about acronyms that you would find most useful? So yeah, this is a very whiz through tour of the kind of thing that we want to try and build. And what I'm asking for today is some feedback on, is this the space that you want? Would you use this space? Are there any aspects that we've missed out that you would like to see in this space? And what kind of things would you want to populate this space? So what kind of blogs, what kind of documentation, things like that. So yeah, we are just a bit of a call for help for any input as to like how this would be useful. So if that's just, you want to drop me an email with some comments, or we can very easily just schedule in a call and we can take you through this in a bit more detail and kind of back it up with where we've got the user needs for all this kind of things. So yes, I will put like my email in the chat, but it'd be great if you could get in touch.
Yeah. Fantastic. And Jessica, there's already some comments going in the chat there about how some use cases and updates and feedback. One of the things I think we might want to do is do a help you do a regular update on this. So if
Yeah,
you wanted to do
brilliant.
half an hour every 2 weeks on NHS
Yeah.
Digital's Open Data Hub, we'd be happy to help you
Yeah.
do
Yeah,
that.
that'd be brilliant. Yeah, I feel we've been stuck in this pre-discovery phase for a little too long now, because obviously just because of the situation. But now it's time that we start getting it built and iterated and stuff like that, which would be ideal.
Fantastic,
Yeah.
and the commitment to iteration in the open is fantastic, because
definitely.
I think it would be. I'm speaking for everyone here. It would be a bit of a disaster to have an Evoala moment where the platform is built and then we have to live with it. Which we've all been at the end of, and we've all suffered from similar tools like that have been built.
Yeah.
So
exactly. That's what this is all about: making sure it's got the best value and that it actually gets used in the best way.
Okay, so
Thank you.
there's great stuff. So Steve Blackburn, I don't know if you've met, you should. He helps run Data Mill North, and Steve likes it, so that's great. That's a good feedback. Fantastic. So Mark's got a point there around collecting data locally, and then row level data modeling, and then how we commit and I think this is really important. So people will join in and contribute to the ecosystem and the project if they know they're going to get something back that's useful to them, and also that their input is valued. So it's I think there's a cultural piece around this about how your open data platform needs to be owned by everyone who publishes data to it. So what Mark's talking about is if they publish data and some modeling's done, that gets fed back as well. So that's a convening role, and it's easy and hard at the same time. It's easy if it's all published and searchable on the web. If it's not, it becomes really hard. So that's really good. John's linked to some public health data from Public Health England. I think this is
the fingertips. We've used that one a lot in our user research.
So I think this is a really important thing: is how do we get institutions that are publishing and sharing data to collaborate and put it all in one place? Now, it's not necessarily the right thing to put it all in one place, but it definitely needs to be linked in some way. So finding the best way to do that, and usually, I'm going to whisper this: if we get it wrong first, that's probably the best thing, because we can get it wrong and then fix it. Is good. So everyone's chatting away. So Jessica, if you put your contact details in the chat, we'll share. You can get in touch with us or via you, and then maybe we'll set up a separate update about NHS Digital Open Data Publishing, and we can. We've already done a guest blog on our website. So if Amy, you can put the guest blog into the chat and into the Open Data Saves Lives documentation, people can have a look at that, and then we can do a second blog post where we ask for feedback, and then do a little bit of online. I mean, if we get 45 minutes every 2 weeks on this, that will be amazing. So yeah, okay. Has anyone else got any questions for Jessica, or any feedback or any support that they would like to offer?
Just a really quick one, Paul.
Yeah.
And I have written it on the chat, but I think it's really important. I think if you could enshrine in what you're setting out to do, that every data set that I provide, I will get access to the same data from every other trust in the country. That's quite a big commitment. So I'm sending 3 sit reps today, one to NHSE, one to PHE, one to the CCG. If you committed that everything I sent centrally, I could have immediate access to everybody else's, that would be quite cool.
Is that all open data?
Sorry, Stuart?
Is that all open data, or are you talking about some shared data there?
Well, take for example the sit reps. Just take something as simple as that. It's not patient level. There's a whole load of returns that we have to create. It's just a sort of a principle. Anything I send, I should get access to the same data for every organisation in return. Otherwise, it's no use to me because I can't benchmark.
Yeah, And I think that's a really good build in terms of the principles and culture around the Open Data Portal, because it's okay just to publish data that people are happy to. And I think what you're talking about there, Mark, is this radically open, is what we talk about. So if we can make a commitment to be radically open, so that even before we talk about publishing data, there's a commitment from whoever is contributing or publishing to this data store or platform, that they will also talk about why they're doing it, who's doing it, what's worked, what hasn't worked, the story around the version, and then also a link to, doesn't necessarily be the data, but the code or a repo of the data. That radically open approach allows people to reach in when they're ready to do their work. And there's also a massive value to, the value you get from publishing your data is you get access to everyone else's, and benchmarking becomes so much easier, and transparency. Great. So yeah, sorry, Jessica, we're giving you some homework there, and it's hard questions.
Yeah.
And what we know is a good thing is, Mark's mentioned about data on ethnicity. We've been talking to partners in Bradford about this, and how we can effectively get an answer to these and help people do that without cutting across all the sensitivities that people have about that sort of thing. And if we can fix it in one place and people are comfortable with that, that then cuts across probably 6 or 7 discussions around information governance that people might have around that. So yeah, very important.
Can before we leave the subject, can I just ask the room, please?
Sorry, who's talking? Where are you from? And what's your question? Thank you.
Hi, it's John Plowman. I actually work for NHS Digital as well.
Hi, John.
My understanding is a lot of what NHS Digital publish, it's aggregated, and to actually get hold of the low-level data that Mark's talking about, having a view of from everywhere, is really difficult. So is that what people generally want? Do they want NHS Digital to process and aggregate and then publish, or would you prefer to have the raw data, the really low-level stuff? I think I probably know the answer to that, but
also,
I have a feeling it's probably an issue that all you can see is aggregated data at the moment.
Yeah, but you could create synthetic data as you go as well, because that's easier IG wise.
Yeah,
you need both. You need obviously you need some governance around real data and it being linked for secondary use.
Yeah.
And you need to do that quicker. We'll always be saying that. But you could also, from what you've got, be profiling nationally and appending codes. You know, if everyone who had blonde hair and blue eyes was at higher risk of COVID, you could work that out nationally and apply that back. You don't tell me, I know who's got blonde hair and blue eyes in Kent, so I just need you to do the modelling. But so you've got two. I agree with Graham. We need the low level, but you could do some synthetic stuff as you go as well.
Does that help, John?
Yeah, thanks. Yeah, it's just really from my experience, even within the organisation, I find it really difficult to get hold of the low level stuff. I've had conversations with Alistair about this before, actually.
Fantastic.
And
so, Jessica, are you picking up a massive use case there?
Yeah, definitely.
What we need is published data that's useful, not what we can publish. If you see what I mean. So, but that's really good. Fantastic. Okay. So we've got people are still joining the chat, which is great. We're still admitting people to the room. So I am now going to I share my screen and go back to the agenda. Okay. So Sarah from Kent Medway is going to talk to us next week about her work and also the Imperial College modelling, which is really important. ODI Leeds, you may have seen, just get an update from us. We're doing loads of stuff around this. We're talking to lots of partners, and we're in week 5. So I guess really is, I just want to mention a couple of the good successes that we've done some. We've shared the work around the Red Cross and vulnerability, and we know from feedback that a lot of people around the country are using this to help them with their vulnerability tracking, and also we get some feedback to the Red Cross about their work. So that's fab. We built a visualization for local authorities because a number of chief execs of local authorities and mayoral offices asked us to build it. We built it. It broke. We fixed it. We've got the data. Public Health England are working with us. And I think doing that has really helped us understand where the data is, and also the confusing geography of the UK in terms of administrative boundaries, in terms of health geographies, about what people want to answer. So that's been really useful for us. But also the fact that our data visualization is now powered by, Stuart, remind me who collects the data for us to power that?
Tom White.
Yeah, so it's classic British grit. So we've got a fantastic hobbyist who's built the best data repo on COVID data, and lots of people to link into that data. And as we just talked to NHS Digital, wouldn't it be great if the repo was hosted centrally and we could all build great stuff that matters to people against their use cases from an official source, but we're actually using a plucky hobbyist who's put this together for us in his spare time, and it's the best one, so everyone's using it. But I think that's
partly because it covers all the 4 nations in the UK.
Yeah, it covers the 4 nations, because that's the question. Why would it not? Of course it would. If you were going to build one, that's what you build. But because of reasons, we don't have that. So there's something around that, and I think also what we're learning is that the passion that we've understood. So we knew this was a really important thing to do. The amount of frustration and passion that we've seen shared with us privately about how we need to change things in the future to make sure that we can respond appropriately to whatever issue that we need to deal with has been really surprising to us, but also it's turned into a positive. So we are a natural glass half full organisation. We want to try and fix things and help people to work things that are better and do innovation at pace. So that's another feedback that I'd like to give everyone here, is that you can see that we've got 50 people on a call. We've had 50 people at each of our sessions of different people from different organisations. The amount of passion that there exists around this to help different organisations work together to try and fix a problem is amazing. And once we've heard from Jenny and ODI HQ, which links into what do we do next, we'd like to just move the conversation on for 10 minutes about what do we do next, how do we partner, how do we make sure that we don't lose the opportunity to do things differently. So I'll stop ranting for a session, and I'll stop sharing my screen. And Jenny, are you there?
I am here.
Hi, Jenny.
I am.
Welcome. If you'd like to just let us know a bit of an introduction from you, what you're doing, and the work that ODI HQ have launched. Is it this week? We launched it on Monday, or yeah.
Yeah, made public on Monday. So, so obviously, as you all know, data is a big thing during COVID-19. So we've been doing a lot of different pieces of work, kind of behind the scenes around that. Things around as Peter has been doing for Ada Lovelace Institute, things around contact tracing and symptom tracking and immunity passports and what those kinds of things look like. And obviously we've been involved in those discussions. But what we thought that we could kind of uniquely add, because there are lots of other national organisations that are doing, and international organisations that are doing work around privacy around this kind of data, is actually pushing more of an open data agenda around it. So we managed to secure a little bit of funding from Luminate to help support this work, and it's broken into 3 parts. There's one part which is the thing that we're really pushing public, which is that they can help us to subsidise working directly with organisations that are wanting to open data and help them to do that well. That includes obviously publishing it well, but also making sure that you're not pushing out stuff that shouldn't be made available as open data in the first place. So we're working with YouGov, for example, on the data that they published, which is individual level data in highly I would say, revealing too much information as open data, for example, and working with other organisations such as symptom tracker apps who are that have been built and that want to share that data back but don't really know how to do it. So direct work and help, and that offer is out there and open for any other organisation that needs help with publishing open data. But then we also have two other strands of work. So one is around kind of research, looking at how open data is being published, where that's being done well, where it's being done not so well. What can we learn from that? How are different countries doing it? How are different regions doing it, and so on? And trying to pull that together so that it's not. We want to do that in a way that contributes to existing efforts to list stuff, but actually draw out some patterns and lessons and some analyses over the top of that. So we've got one strand that is going to be focused on doing that over the next 6 months, and then another strand within that that piece about what is going on and what does good practice look like, especially kind of publishing open data in an emergency or publishing open data at speed. We're trying to pull together some proper guidance around that we'd love, and I think has already been shared with some of you at least. We'd love feedback on, both around how to do that from a publication perspective and also how to manage risks around publishing open data. So we've got a couple of pieces of guidance that we're working on and should be public really soon. And then third strand of work is just about pushing the message around open data in the press, in the media, in organisations that tend to be a little bit or have locked themselves down because they're trying to do everything in a rush, and trying to get them to be more open and open stuff up and publish their code and publish their data and just do that kind of noisy and quiet advocacy for all of this. So that information is all on our website about the project and the particular call to action, as in if you are wanting to publish some data as open data. That's it. Sorry, Paul, are you muted?
My internet connection went wobbly for a minute. So yeah, I went silent for a minute there. So thanks very much, Jenny. So how do people get involved? I missed mine went wobbly for the last 30 seconds of your your talk there. So what's the best way for people to get involved with your work, and how could they ask for help?
So if you, I think you already have, but I can share the project page which describes the different things. So there's for people who want help, then there's a form to fill in, say this is the kind of help that we need, this is what we're trying to do, and this is why. For people who just want to be kind of connected, or that have use cases, or that want us to push something, then there's an email address which is, I think, covid19@theodi.org, to get in touch with the team. And it's Olivier, our head of tech and R&D, who is leading this piece of work.
Fantastic. Thanks very much. Thanks for your help. So we have we've met my target of trying to get this undone in under 45 minutes. That's 44 minutes. What I'd like to do now is just spend another 5 minutes, if you like, just talking about what people would like to do next, any points that they have they're really passionate about. So if they can put it in you can either put your hand up physically, or put your hand up using the Zoom method there. Myself and Amy will bring you into the conversation. Okay, so would anyone like to make a point if they've got something that's they're really stuck on that they need help with, what they would like to see us do next, anything like that? Okay, while you're all thinking about things you want to do next, I'm going to tell you about what we've been doing a little bit. So we made a bid to the Innovate UK. I think it's the call for COVID responses. We made a bid to Innovate UK last week to amplify the Open Data Saves Lives work. So that we'll find out about that next Friday. Hopefully that will help us do more like this, and obviously springboard off the use cases that we've identified. We're talking to a number of organizations who are frustrated in the way that people are collaborating or not collaborating, or want to see more open approaches, not necessarily open data, but open approaches to how we build useful tools, and we don't just create a whole load of wheels that everyone's built that are slightly different. So there's a real conversation around that. So if you want to get in touch about how we build a common approach to responding to not just COVID, but build useful tools and iterate rapidly and wildly in the open, that will be grand. So let us know about that. We've got a number of calls and then the second bit is that we, a bit like Jenny, lots of people have emailed us and asked us, oh, you've got the data, haven't you, about this thing? Can you just fix it? We have it in a bag that's available for them to fit their specific use case. So we have a whole load of other things is about how we can be radically open, so that when people do have those questions about where is that data, it is easy to find on the web, and I can just search Google to find that. So there's three bits to our work, and that whole thing about why ODI Leeds or ODI HQ that we should have that data available to us to answer the specific question from whomever, whether it be about the economy, about health, about transport, about all of the things that people have questions about now. We're collecting them, and we're going to try and create a feedback around, okay, so why didn't we have this data? We should have this data in the future. How do we fix that? So that's another part of what we're doing. So Steve Blackburn, can we emphasize this, please? Do you just want to tell us about that point you're asking about?
Hi, can you hear
specific
me?
Yes,
yeah.
We can hear you, Steve. Yeah.
Okay, cheers. Yeah, all it is, Paul, is so Hannah and I have been doing I would say an awful lot of work trying to identify data sources around the
So you
council.
just want to tell people who you are, just so that people know?
Oh, sorry. Yeah, sorry. My name's Stephen Blackburn. I work for Leeds City Council, and with Hannah, with Hannah Roden, we lead on open data work at the council, and also smart cities work as well. And we also manage the Data Mill North website that some of you may have heard of or used in the past. And what we've been trying to do with the COVID work is identify data around that we're collecting within the council, but also speaking to third sector organisations and others as well, and hopefully get that published on the Data Mill North website that then others can reuse. For example, it might be understanding where volunteers are, perhaps, and we're obviously not talking at a granular level here, but perhaps where vulnerable people are, and do we have volunteers in the right places, for example. So we've been trying to sort of find that kind of data that we could publish on the Data Mill, and I have to say, I think Hannah and I have put much more effort in than so far we've actually got out, which leads you to question whether it's all been worth it, I have to say. But we have been asked a couple of times, well, perhaps by people who may be not quite as connected with the whole sort of open data world that we are, that well, why would you want this data? I can go and ask people, but they're gonna want to know why you want this data, and give me a reason for opening it up. For us, the way that that we've always viewed open data is, look, it's not to some degree for us to question why somebody would want that data. We just should be open and transparent and publish as much as we possibly can, and then others can reuse it potentially in ways that we never imagined. So it's but I can also I take into account the sensitivity around the data that we're talking about in this. So I kind of take on board what they're saying. So if people have got specific use cases that we can then go back to these people and say, look, this is the reason why we would love to get this data published openly. It might just give us a bit of leverage, perhaps. So that's what that's about.
Cool. So maybe a set of YouTube videos with people who are saying, give us your data, stop hiding it. These are the reasons to do it, get over it. Maybe not as as forceful as that, but we need some clear use cases for people to say, why wouldn't I do that, rather than why would I do that? Fantastic. Okay, yeah, and Jenny's just added the use case document there that they're putting together for the, yeah, that's fantastic. And Thierry's added something in the chat, so have a look at that. And this is exactly what Open Data Saves Lives is about, is sharing our specific problems we have today and trying to help others to fix them. Okay. Would anyone else like to make a point before we finish?
Just a quick one, Paul. I'm conscious I've spoken before. This has been named Open Data Saves Lives because there used to be a thing called Data Saves Lives, which was from the brilliantly named FAR Institute. But there's not much written, I don't think, that talks about why you do it. And I think as well as trying to hoover up all the data and get it in one place, I think there's a narrative that this group could help create. So what I get a lot of is, I talk to my team and I go, that's a really fascinating piece of data. Can I send it to the CCG? And they go, well, I don't know if we've asked the chief operating officer. I don't know if he'll be happy to let it go. And there's this whole adversarial thing about data is oil, you know, and if I've got mine, I want to share it with them and all of that. And I do think we need more literature on this, more references that you can go to that say, this is why it's a good idea. You might not agree with it, but there's quite a body of evidence. And I don't think there's enough yet in health around that body of evidence.
Yeah.
A few hashtags. So I think some writing to do.
Fantastic. So I think I have written a couple of blog posts and I've not published them because they are too argumentative and confrontational. If you know me, that I would rather not be that, but it sometimes comes across like that. The world of health, there is a problem in that I'm not a health professional, and therefore whatever I say, although it's changed over the last couple of years, is almost it has to come from the right place, I feel. So there's something where, and I think you're right, that maybe some research that's published by health professionals about open data would allow us to talk to the health ecosystem, rather than saying that, well, you don't know our context, and they're allowed to ignore us. So there's maybe we can have a chat maybe separately, Jenny, that no matter what we say, the people working in the health professions are allowed to ignore us because we obviously don't know their context. But there's a whole piece around that. So yes, let's get that on the list of getting those sort of things written and built. And I would say also we need to use the web as it was intended. So rather than a research paper, it needs to be a blog, it needs to be a video, and it needs to be widely shared so that anyone can do that. So I guess we might be giving some use cases to Jenny there for the work and what we do next, and this is fantastic. John, you had Jen, do you want to come in a second? John's just raised his hand. You make your point, and then we'll come back to Jenny.
Yeah, just to follow up from Mark's point from SCW perspective, we've seen in the last
John, what's SEW?
Sorry, everybody else. So it's SCW is Southern, Central, and West CSU. We are basically a system integrator and enabler. We provide business intelligence right across the South, Central, and West. We've got a number of analysts. So we're supporting all of the sort of systems infrastructure. So we've seen we've done a bit of review. We're really keen to keep momentum because we've seen probably things that have happened in the last probably 5 weeks that would have taken us probably 10 years, maybe more. And we want to keep that momentum going. It's kind of following on what Mark was saying. We've seen on the digital transformation front, we've moved significant amounts of health provision from GP appointments, outpatient appointments, basic consultations. We've literally moved them online in record pace. We've gone from 30% to about 95%, which is absolutely huge. We've also seen, rapid discharge of patients in hospitals into the community really, really quickly, removal of red tape, and we've actually mobilized huge amounts of partnerships. So it's just I can share some of that thinking and the research we've done, and we're trying to publish the lessons learned that we've done in the last 4 weeks and keep that momentum going. That's helpful for people. But it's trying to get a movement that we keep that momentum going, if that's helpful.
Okay, yeah. Thanks, John. Jenny, you just wanted to come back on that.
Yeah, I was just going to say that I think that one of the things that I've seen that I've found really frustrating is, as I was alluding to, a pull of data into the centre and then not pushing it out, and the kind of the strong message that we at local level need this data in order to do the jobs that we are supposed to be doing at local level. I think that's the message that I feel needs to be made really strongly, and I think is a I think it's a pretty compelling one, especially when it's coming from NHS trusts or from local authorities to say this is what we're giving you all of this, give it back, like you say, Mark, give it back to us as well. So I'd be really happy to work on trying to make that point. I think, having the concrete use cases for why would be really helpful in making that more strongly. It's also very hard to get the people who are in the centre to prioritise that over all of the things that they're needing to do to satisfy their Secretary of State, for example, right? So we need that message to be coming from multiple sides in order for it to be heard.
Okay, great stuff. So I'm going to try and finish this before the hour, because that's one of my all video calls should be less than half an hour, less than an hour. So thank you very much for everyone from joining in. We've already got some guest speakers for next week already set up. So talking about the Imperial model and working at Kent CCG, which is great. We've got Ordnance Survey talking about their open data. I am really happy they're coming, because I would like to know exactly what it works and how I do it, and is it simple and easy to use, do we think, or is it come with lots of caveats and mysterious licenses? But let's hope that it's as widely and radically open as possible. So they're really welcome. And then if we're going to be talking to lots of other people this week, possibly got the Health Foundation joining us next week, and possibly got some practitioners from Leeds that are going to join in as well. So it's fantastic. And the last point that Jenny's make there, this isn't just health data. And some of the early work, right, the first 2 sessions of Open Data Saves Lives was how do people in different organisations who need to look at similar data sets work together quickly to make that easy to use, and they don't have to ask permission. That's another fantastic thing about how we get organisations to collaborate with each other without having to ask for permission. And we would say being radically open is the way to do that. So thanks very much, everyone. Please join in. It should be fun, so please do that. And we'll hopefully speak to you next week. Thanks very much. Cheers.
Cheers.
If the ODI Leeds team stay on, we'll just do a quick wash up.
Paul, I might have to dash. I've got a call with Leeds City Council now.
Oh yeah, you and Giles got to do that. So yeah, if Amy,
yes.
Go, you do that. If Amy and Stuart stay on.
Okay.
So you're with Giles doing that.
I've got to